Dr. Powers is expecting you. He's in this room.
Welcome, and I would like to tell you about my experience with our local hospital here, the former Palmdale Hospital, being closed. I have had patients who were actually saved in that hospital just before it was closed. For example, I had a lady who came in, and 4 minutes after she drove herself in there, she had a rhythm that would have been fatal. If she'd gone on to drive herself to Santa Rosa, she wouldn't be here today. She's very healthy because she was on a monitor. She was revived immediately. She had no damage. So that's just one, and it was a few days before the closure. Because the hospital has been closed, we've had lots more difficult time taking care of our patients here. And the good news is that this hospital is going to open again. We have a plan by the end of April, which is just 1 year from when it closed. We'll have the hospital open so that the people who live here in all of West County can come and take advantage of the excellent care that will be provided. It's going to be everything that it was before. It's going to have all the most extreme caring care, which we uniquely distinguish Palm Drive. It's going to have the full service emergency room and surgery and the med-surg care and ICU care, all of which has been of very high quality. We plan to have all of that, and then we have some additional things that are improvements. Some specialists that will be coming here that never were here available before. And we'll have the good ones we've had in the past with Orthopedics and Neurology are here, committed to staying with us. I wanted to mention that I have many patients, 150 during this past year, who live in the river area and who do use Palm Drive and who are very loyal to this hospital. And that's just my practice. There really are many, many more patients for all of the practices here in town that do use Palm Drive and care about it. Well, I need to mention also that there are times of year during the floods when patients here can't get to Santa Rosa, and we have had very good emergency service for people of all kinds. There's a timing issue from coming from the coast, which is a long ways, and both from the river area and from Bodega area. So we really do appreciate having this facility available. We never know what might happen in an earthquake and bridges and things are down. And this has been a great resource for our people, and our emergency crews bringing people here get back to their duty station much quicker. So the issue also is that we have the access here, a unique helipad next to the hospital that is able to transport people to San Francisco or to Oakland Children's and to provide very good resources for transfer for people to real emergency care. The emergency room will have a new director and a new set of doctors, many of whom have worked in other trauma center and bigger hospitals here locally. And those doctors are experienced and very capable of handling all sorts of emergencies and traumas, and thus the quality of our emergency room will be even further enhanced with the new director and new physicians here. Well, you know, the other thing is that many patients who have Kaiser or have other insurance do have emergencies, and some of them are visitors from elsewhere and some of them are here, but the emergency care is immediately available, and our plan is that every patient who arrives will be seen by a physician within 5 minutes. That's what we call it, a no-wait ER, and that is a concept that's well established in other community hospitals where Dr. Look has worked, and so we expect this emergency room to provide that quality of care with the high-quality physicians that are recruited to be there. We also really serve our community so that the whole hospital will be a much better institution. It'll be so good with the institutes that people are expected to come from elsewhere. Whenever there is a real emergency, something life-threatening like a stroke or a heart attack, the emergency crew brings the patient to the closest hospital, and in many cases that's going to be here, even for patients who have Kaiser or have a Sutter program or something that might choose in a less urgent situation to go elsewhere. It's been very difficult to take care of patients when I have to get my stat lab over in Santa Rosa, when I have to send all my x-rays to Santa Rosa. People just don't get the care that they would when we have our emergency room open again. I need to point out too that the Palm Drive Hospital is gone, but this hospital will serve the same people. It won't be just a boutique hospital. It really is everything that was here before for all the people that live in West County.